Hello, my name is Dr. Naila Siddiqu Kamal. I'm a gynecologist and an enthusiast in using disruptive technologies in the delivery of healthcare. My particular focus is how we can use these disruptive technologies in preventing harm, and in particular preventable harm. The scale of the problem of unfortunately of avoidable harm occurring in our day-to-day clinical practice is to an extent which is totally unacceptable. According to a report published by Forbes, about 400,000 people are killed each year due to preventable medical errors, and these include hospital-acquired infections. Let's talk about what do we mean by disruptive technologies. So we are in the era of digital industrial revolution. That is, we've moved on from the age of electronics, and now we are using quite complex digital software and digital applications. But in fact, we are at the cusp of well into the next industrial era, which is called as the era of machine learning, where artificial intelligence, augmented reality, mixed reality, and so on and so forth are being used in the digital applications in order to achieve better patient outcomes and reduce inefficiency and negative outcomes. My interest has been that how do we use these in order to prevent or further reduce the instances of avoidable harm. Another point to consider here is that how the industry has reacted to the introduction of disruptive technologies in healthcare. According to a report published by Frost and Sullivan, an analyst company, the focus of disruptive technologies which have been forecast to 2022 is patient safety, and the amount of investment which currently, which in 2016 was considered to be $317 billion, will go up to $383.7 billion by 2022. Hence, we see there is a great thrust in the innovative technology to be focusing on patient safety at the heart of its disruption, and this is what is driving the industry at the moment. In order to convince those who still are sitting by the fence, not unsure about what actually the technology is going to bring to us, I would like to use a study that was published in 2014, and it looks at thematic analysis of deaths that happened in England due to patient safety related issues between the time of 2010 and 2012. So this report was published by two very prominent individuals in the field of patient safety, Sir Leon Donaldson and Professor Aura Darzi. These are both prominent figures in the UK health settings. So the report found that there were basically 6 themes that came out, and these were failure to act on or recognize deterioration in a critically ill patient, management of the deterioration, failure of prevention, deficient checking and oversight, dysfunctional patient flow, as well as equipment failure. So these were the main 6 themes. Now, if I was to take each theme and give an example of how the new technology is working, that may help you to understand what actually disruptive technologies bring to the table. So, with regards to failure to act on or recognize deterioration, there is an app that I would like to use as an example, which acts as an electronic intern. And what it does is it identifies crucial health details that a doctor will need to, and organizes them in a way that is easy for the healthcare expert who is looking at the data to understand or identify the critical condition of the patient, and there is an alert. What it does is that it is affiliated with an EHR, with the EHR data, that is electronic health record data, and lets the provider know if a proposed course of treatment or medication may be harmful to the patient. This is a second outcome that can be linked with it. Hence, while we are dependent on humans to detect any deterioration of a patient, here is a technology which uses artificial intelligence because it's programmed in that way, and humans have actually put in that intelligence and algorithms that it can pick up anything that is not within the normal parameters. Hence, you can imagine, individually we are looking after so many patients in busy environments, while as the machines can help us in focusing and prioritizing our work. Similarly, another use of disruptive technology is installation of sensors that would alert clinicians about critical tasks that they have to perform around a patient. Again, one doctor may be looking after 30 or so different level of complexity patients, and there needs to be some kind of a fail-safe which prevents the latent factors to come in and cause lapses in judgment. So this is where machine learning can help and become an aid to clinicians. And so on and so forth. There are many such applications which can help in these areas. Hopefully, dear listeners, I might have convinced you for the use of disruptive technologies in preventing avoidable harm. If not, at least got your attention to maybe learn more about it. So let me tell you what the barriers are when we come to healthcare innovations. So this was a publication that was presented in the Mobile World Congress 2018 in Barcelona, and they identified 10 barriers to healthcare innovations, and these include clinician time in order to look at the efficacy and review it, the distribution of a product, manufacturer access to the data, because the issues of intellectual property as well as confidentiality. Similarly, the insights into access of healthcare providers, regulatory oversight. And it goes on as to, the culture. We are very adamant towards adopting anything. And then when it comes to something that we don't understand, that becomes even more, resistant and resilient, resentment is shown to considering anything but what we have been doing for a long time. But the important message that I would like to convey here is that we don't have an option now. The amount of medical complexity as well as presentations and the turnaround has become so vast, and coupled with workforce challenges as well as resource challenges, we have to come up with smart ways of doing things. And machine learning and appropriate use of disruptive technologies with a fail-safe, which goes without saying, is our only way or our only option at the moment in order to consider mitigating the risks that are involved in healthcare. Hopefully, now I have converted you as engaged audience, and hopefully you are all believers in the use of disruptive technology. So let me tell you what are the enablers if you are to engage with it and try to bring it to your work practice. So first, the most important thing is to understand how this innovation is going to bring effectiveness to your work, and how it is going to be cost beneficial as well. If it is aligned with your organizational culture, it becomes even more seamless to adopt. Simple things first. So I would advise go for the low-lying fruit, as they say. That means things which are less costly and easily adaptable in the beginning, so that you have experience of engaging with disruptive technology, and you can convince your peers and your colleagues as well with the benefits that you may see in a short time period. There needs to be some flexibility around your product as well. So whatever disruption you are thinking of introducing in your work setup, it maybe it needs to be jiggled a bit and amended in a way that it conforms with the systems that are existing in your healthcare organization. Similarly, there needs to be a risk balance, associated. So we are technically or inherently risk averse as clinicians, but sometimes we have to assess the pros and cons of what level of risk may be an acceptable risk in order to bring a better benefit to a wide number of your patients. And this another thing that goes hand in hand is how you can cascade the information across your team. So if you're the only one who understands this and none of your team workers understand how this product actually is bringing benefit, then you become you might be in the silent sole person, and in order to get more productivity, your team needs to understand and share the value as well. Hence, as we know that as humans are fallible, machines can be fallible as well. So it is best to use this technology, the disruption, in lab environment first. So if you are buying it off a vendor, ensure that you actually go over the lab experience of that particular product, so that you understand what were the hitches, and so that you can go over your own environment and make sure that that doesn't happen locally. Again, the technology is a process. It needs to be part of a longer process ongoing in order to prevent your ultimate goal, which is to bring efficiency, effectiveness, and reduce harm. So now that I have a convinced audience who is just raring to go and adopt disruption in order to reduce preventable harm, these are my golden nuggets of advice which will help you in becoming successful in your endeavor. So first of all, become a believer. So when you believe that this, yes, you're convinced and you've seen what the disruptive technologies can do in helping you achieve your ultimate goal of looking after your patients in a way that is ideal with high standards, then you will be able to motivate your team as well. You need to fall in love with the problem, not just the solution. So it is, we often see that people commission or invest in very expensive solutions, but they have not fully understood their problem, and hence the solution may not be the exact fit for what their problem is. So you need to understand all the various parameters of your problem, and then when you are shopping for this disruptive technology which you're hoping will solve your problems, you will be able to assess at every level. As I mentioned before, we are very risk averse. However, there needs to be a balance, and the fear factor has to be overcome. And let's not become scared of technology. I remember the time when computers were brought in, and there were a lot of my, let's say, senior colleagues were totally dismissive of it, and they wanted the good old typewriter and handwritten notes. And now if you look back, you can't even imagine how we would have coped without the existence of computers. So same thing applies with these new technologies. Motivational leadership is what I think will make the technology be accepted more widely. Hierarchical, maybe at the level where you make a decision and decide that this is the one that you are going for. However, collaborative and motivational leadership is required for you to get kudos from your colleagues and acceptance. As I mentioned, high impact, low cost projects are best to be focused on before. Keep on doing your PDSA and evaluation cycle and be vigilant for the unknown unknowns. As I mentioned before, nothing is 100% fail safe. There's always a chance of things may not working out exactly the way they are meant to be, whether they are machines or humans, but we need to be on the lookout for them and be prepared to tackle them. So the better you understand your problem and the solution, the better placed you will be in order to focusing on getting the right type of a fix for the issue. So I will end here, and I hope this little brief talk has arisen some interest in the use of disruptive technologies, especially in answering some of the very crucial challenges that NHS is facing right now in the UK and in many places globally. I thank you and hope to see you again in any one of similar type of webinar.